and said that until we get universal coverage, he wasn't going to take this. But the idea that all Americans ought to understand now is what we are standing for, and I commend the senator again from Montana and the senator from Iowa and the others, and my friend Senator Hatch, who we worked with years ago, and Senator Rockefeller on this program, is a rather simple and fundamental concept, and that is this: that every child in America ought to have a healthy start. We are about, here in the United States Senate, we are about expressing priorities. And those of us on this side of the aisle, and a group on the other side, a small group on the other side, courageous group on the other side, have stated that same concept, that every child in America should have a healthy start, number one. And number two, that every parent in America should be relieved of the anxiety about worrying whether they have sufficient resources to be able to make sure that their child is going to receive decent quality of health care. Those are revolutionary thoughts, huh? Those are surprising concepts. Is that right? Evidently, our friends on the other side of the aisle get all worked up about that, those two concepts, that all children in this country should have a healthy start, and that mothers and fathers, but mothers and fathers should be relieved from the anxiety that when their child has an earache, or their child has a sore throat, or their child has a headache, they have to wonder whether their child is $150 or $175 sick, because that's what it's cost to take emergency room. So they wait overnight. They let the child get a little sicker. They have a sleepless night. They worry. They hope and they pray that their child gets better. Well, we in this body say that America can do better. I listened to my friend, and he is my friend, from Mississippi, talking about the cost of this program. $60 billion over 5 years. That's what we're spending in 5 months in Iraq. 5 months in Iraq. What would the American people rather have? Coverage for their children or a continued conflict in Iraq, where we're losing the blood of our young men and women? This is the issue. Let's not complicate it. Let's not make it difficult. Let's not make it unreasonable. And that is what this is about. Sure, which listen to the arguments, someone's going to have to pay for it. Yes, it's going to be those that are going to be smoking. What is the result of increasing the tobacco tax? What is the direct result? Tobacco, cigarettes, when used as advertised, increase deaths in America. Among who? Among children. Every day, 2,800 children become addicted. Every year, 500,000 people die because of the use of tobacco. So what happens when we raise the tax of 60%, 61 cents on the cigarettes? You know what happens? Children stop smoking. Oh, they do? Yes, they do. Who says so? Who says so? Just look at the history of what has happened when we have increased the tax on cigarettes. So, Mr. President, I commend those on the Finance Committee for finding a revenue measure that will make sure, that will ensure all children are going to stop and end smoking, but that this will be a major disincentive for young people to smoke. On the other hand, it gives children a healthy start and relieves the anxiety for parents. And thirdly, it makes sure, or it discourages children from smoking. So, Mr. President, this is a measure that speaks for action, it speaks for justice, it speaks for fairness, it speaks for our values. But I, for one, who strongly believe in the concept of a comprehensive health care, and we'll have that debate at another place and at another time. But, Mr. President, when I know that my children were covered. They're grown now, as others have been here, but I know when they needed health care, I know that they were able to receive it. And I remember very clearly that when my child had lost his leg to cancer, we saw families in that chamber that were absolutely driven into poverty because they couldn't afford the same kind of health care that we had. And this is a statement and a comment that we here in the United States Senate find children to be a priority, find their parents to be a priority, find it to be in the interest of children to increase the tobacco tax. This legislation makes a great deal of sense, and I again commend the sponsors for it. Whatever time remains, I'll yield to my friend and colleague from Connecticut, and I ask consent that my full statement be included in the record.
Without objection. Senator from Connecticut is